Good afternoon, and thank you for joining us for our Q&A event as part of our webinar series on how blended, braided, or sequenced funding can help drive employment, equity, and inclusion. My name is Vince Kohler, and it's my pleasure to welcome you all on behalf of the LEAD Center, the Center for Leadership for the Employment and Economic Advancement of People with Disabilities. We're a WIOA Policy Development Center for the Office of Disability Employment Policy. The LEAD Center is operated in collaboration between Social Policy Research Associates and the National Disability Institute. And together we facilitate the adoption and integration of inclusive WIOA programs, policies, and practices through research, technical assistance, and demonstration projects on behalf of the Office of Disability Employment Policy. This is number 3 in a series of events following a webinar in March and in June that many of you might have participated in, when our panelists presented how they have used blending, braiding, and sequencing of resources in their states and regions. In March, we featured 2 states and 1 local area, Colorado and in Arizona. And in June, we focused on practices in the great state of Maryland. In those 2 webinars, we collected so many questions that we simply could only address a fraction of them during the Q&A period. And this is why we're focusing on questions today. We're delighted that you've joined us today for a webinar where you'll hear from those same panelists with a full event dedicated to get to as many of those questions as possible. But before we get any further, some brief housekeeping. If we can go to the next slide, please. Well, that's me. We'll get through that fast. I'm Senior Strategist at Social Policy Research Associates, and I'm just glad to be here. And then we'll go right on to the next one. To ensure that everyone can participate fully in today's event, we'd like to take a moment to share some captioning and housekeeping tips. Today's event is live captioned, and the captions appear below the slide deck. You also have the option to open the captioning webpage in a new browser, and the links have been posted in the chat, or will be momentarily, by one of my fantastic colleagues working behind the scenes today, and there are quite a few of them, those fantastic colleagues. Once the captioning window opens on your own system, you can adjust the background color, the text color, the fonts, using the drop-down menus at the top of the browser window. We suggest you position the window to sit right on top of the embedded captioning to allow you to see the screen itself. Next slide, please. Today's event is all about your questions. At any point, you can click the Q&A button that's located on the Zoom platform's menu bar, and this will bring up a Q&A window into which you can type questions for our experts from the field. And if you're experiencing any technical issues or have questions for the technical support team, click the raise hand button that's on the menu bar or use the chat box and we'll respond to you directly. To kick off our day today, I'd like to say hello to Assistant Secretary of Labor for Disability Employment Policy at the U.S. Department of Labor, Ms. Taryn McKenzie Williams. Ms. Williams advises the Secretary of Labor on how the department's policies and programs impact the employment of people with disabilities and leads the Office of Disability Employment Policy, or ODEP. Ms. Williams.
Thank you for that introduction, and good afternoon, everyone. It is such a pleasure to welcome you to this webinar on blending, braiding, and sequencing. I am so excited to be here today. As you heard, my name is Taryn McKenzie Williams, and I serve as the Assistant Secretary of Labor for Disability Employment Policy at the U.S. Department of Labor and head our Office of Disability Employment Policy, or ODEP for short. And ODEP's mission is to develop and influence policies and practices that increase both the number and quality of employment opportunities for people with disabilities. And it is a mission that I care about deeply, and certainly it has been a defining commitment of my career. And under this administration, one of ODEP's major priorities is to increase competitive integrated employment for individuals with disabilities, allowing them to participate fully in their communities. And today's webinar Q&A will help provide strategies to further that goal. Our primary objectives today are to alert you about a new resource that I am so excited to share, will be released next week. I think it's fair to say that it will be hot off the press. This resource is an interagency blending, braiding, and sequencing memo and frequently asked questions attachment, or FAQs, on resource leveraging, and answers your questions from our first two webinars about blending, braiding, and sequencing. Today's speakers will address your questions and go even more in depth on the blending, braiding, and sequencing strategies being used in their states. And I want to thank the Lead Center for their collaboration and leadership. I also want to thank all 8 of our agency partners in the White House-led work group on blending, braiding, and sequencing for their help in putting this webinar together today. It has been a collaborative and truly a team effort. It's my honor to let you know that this work group developed an informative interagency memorandum on blending, braiding, and sequencing, and that the work group also developed that FAQ document. And both of these resources will be available on ODEP's website next week, and certainly will be included in the slides that will be shared with you after this webinar is completed. We hope these resources will be useful to you because they reflect the recognition of all of these agencies on how important these strategies can be to promote collaboration and leveraging of resources and funding across systems to support CIE. And in addition, the memo and the FAQs provide concrete examples of ways to blend, braid, and sequence funding to provide the supports to people with disabilities in order to be successful in competitive integrated employment. So thank you again for joining us today. And with that, I'll hand it back over to the Lead Center who will get us started. And I'm looking forward to hearing your questions today. Thank you.
Thank you so much, Ms. Williams. That's great news. And we're looking forward to posting that memo, and we'll have a link to it when these slides get released as well. With that, as our preamble, so to speak, let's get right into the meat of the matter. As the webinar title suggests, we're covering 3 strategies of bringing multiple funding streams together to support individuals with disabilities as they pursue these employment opportunities that Ms. Williams just mentioned. We're going to hear examples of blended funding where multiple funding streams combine dollars to create a single pot of dollars to purchase services for customers. In this approach, funding from each program loses its program-specific identity. Typically, this requires explicit authorization by statute or regulation to allow the blending of funds. To continue on, in the middle, you can see represented colorfully by a braid, multiple funding streams separately and simultaneously purchase and provide specific services to customers. This requires interagency coordination and collaboration with a goal to deliver more effective supports. And then on the right, with an image of the baton being passed in a relay race is the sequenced approach, where service is supported by different funding streams and arranged sequentially rather than simultaneously. Of course, this requires interagency coordination and collaboration as well to ensure that there are no gaps in needed services. So that's those are the three methods in 60 seconds or less. And so much about the theory. Let's now take a look at how this works in a real world. And before we do that, if we go to the next slide, we'd actually like to know a little bit about who is here today. So we'd like to get to know you a little bit better through a poll. So with our first question, and I think we'll get the poll here showing up momentarily, we would like to have you tell us about what organization you work for or represent. So you can just click on the answer that applies the best to you as we go. We'll give that a few seconds here. And you can also answer the second question, and that is how much experience do you or your organization have in blending, braiding, and sequencing of resources on behalf of your programs and your clients? So we see some of the responses coming in here. It looks like about a third are from organizations that only serve people with disabilities. About a third work for the state government. Maybe about a sixth for local organizations, about another sixth for some other type of organization, and a few work for state government. And now it looks like you can see the results as well. Great, thank you for participating in this poll. I think you can still answer. Okay, I think that worked. Are we seeing the results for the second question as well? Great, thank you so much. All right, so today we are going to hear, as was mentioned before, I think, from representatives from 4 states. From Colorado, we have the Office of Community Living, Health First Colorado, and the Division of Vocational Rehabilitation. From North Carolina, the Vocational Rehabilitation Services of the state. From Arizona, it's the Sonoran Center for Excellence in Developmental Disabilities, the Rehabilitation Services Administration, and from the Baba Kivari Unified School District from the Tucson area. And then from Maryland, the State Workforce Development Board, the Division of Rehabilitation Services, the Employment Network, and the Arundel County Workforce Development Corporation. So those are the folks that are here. I'll introduce the individuals as we get to the questions. So really want to thank all of our panelists for being here with us today. And as I said, feel free to drop us questions. We're going to go to some questions that came from previous sessions. We'll weave in your new questions as we go. And we'll go right ahead with our first question. And with this one, I think we'll go to Maryland. And in Maryland, we have Kate Drake, the Community Rehabilitation Program Staff Specialist with the Maryland Division of Rehabilitation Services, and also Stacy Seymour, who is the Director of the Statewide Employment Initiatives Employment Network. So Stacy or Kate, where does the vision, this is kind of a point of origin question, where does the vision to utilize multiple funding sources come from? Did it start with a service provider seeing a need, or were there other sources? What was the point of origin in your experience?
So in Maryland, Vince, it was a top-down process. Over time, we've been very fortunate and had some wonderful leaders working collaboratively through our state behavioral health and vocational rehabilitation programs. It started with a vision to leverage the resources of both agencies as a solution. They could see that alone they could not fund the services sufficiently, but together they could collaborate and benefit the consumers and the providers.
So this initial vision, it continued to grow over time. It continues to grow as we continue to collaborate. There's really been ongoing innovation, which included both the state and local levels. It's an ongoing process. So together we started with this initial vision, and then over time we've developed a braided funding mechanism, which not only meets the needs of the individuals served, but it also incentivizes our providers who are following an evidence-based practice model for employment services, which in Maryland is the individual placement and support model. It also, we've been able to streamline the vocational rehabilitation services referral process through the state's contracted administrative services organization. We've also been able to establish an approved administrative employment network through Social Security's Ticket to Work program to enhance those long-term services and supports for individuals in the public behavioral health system. And really, this vision, it can come from any level, top down or bottom up. However, in our experience in developing supported employment services, for this particular population in Maryland, it really began with a vision of leaders who were able to come to the table. It's been really wonderful with the ongoing regular collaboration. We've been really fortunate with some open-minded and creative leaders that are approachable and willing to come to the table, not only to talk about funding, but also to develop relationship, discussing ongoing policy and regulation changes and better understanding the needs of each agency. So really it was being approachable and having leaders in both agencies, which have been more creative and kind of out of the box thinkers.
That's great. Thanks. That's really helpful. And I could see that, you know, in some ways, perhaps where it gets started may not matter so much. It could start at the top, it could start in the middle, it could start at the bottom. And then the question is, how do you pursue the vision that all of you coming together have brought together? This is great. The next question is really one about the seamlessness of the experience. So with all of these processes, whether you sequence, whether you blend, or whether you braid, always have a goal of making it as seamless as possible from the perspective of the customer. So I'm going to post the next question to Alice Farrar, who is the Chief for Employment Services and Program Development at the North Carolina Vocational Rehabilitation Services, and would like to just get your take on what happens when two programs braid these resources to fund supported employment services, for example. What processes have you implemented to make it as seamless an experience for customers as possible?
So thank you, Vince. It's nice to be here with everyone this afternoon. And you're exactly right. We have to make the funding process as seamless as possible. And doing that is just invaluable to our customers. We don't want services to be delayed. We don't want providers to question whether or not they're going to get paid, or how they're going to get paid, or how they might bill for the service. We owe our customers really that clarity and confidence that the funding structure is going to work for them. But that's where the rub is. The clarity and confidence takes an awful lot of communication, and Stacy mentioned the word collaboration. There is a tremendous amount of collaboration that is ongoing, and it is with internal and external stakeholders. This ongoing communication and collaboration, it should occur in multiple ways: in writing, verbally, virtually, and in person. and with all the stakeholders, not just our state level people, but inclusive of our trade associations that we might work with, and our providers, our direct support service staff, as well as program directors of providers. It really needs to be communication that's inclusive of all the partners. Then internally, I think it's important that our divisions have to be in lockstep with each other, that everyone is on the same page, and perhaps that takes an intra-departmental agreement or a memorandum of understanding with each other, just to make sure that everyone stays on the same page and we do all have that same vision that Stacy and Kate talked about. So in North Carolina, an example of when we implemented some sequential funding, we've been met with success, but it's not without some pitfalls. And where we've seen it work the best is when the idea first started and all partners came to the table at the beginning. So our providers felt heard. We were able to take some of their suggestions and implement them in the way that we went about establishing the funding structure. They stayed involved. Not everybody got exactly what they wanted, and that was okay. I think the big thing was that they felt heard and that we had a very transparent process in moving forward. And even with the funding structure implemented, it still takes ongoing communication to address concerns and come together regularly to work through any issues that come up.
Great, thank you, Alice. I could see that not only do you need to stay, things change over time, staff changes, so this ongoing communication and coordination seems really crucial for the experience, again, on the customer side to be as seamless as possible. So really appreciate that. All right, we have another question here that came in, I think from a previous session. And we're going to go to Arizona because we had representatives from Arizona who had just the answer for this question. We're going to hear from Kristen Mackey, who's the administrator at the Arizona Rehabilitation Services Administration. We will hear then from Wendy Perrin-Johnson, Executive Director at the Sonoran Center for Excellence in Development Disabilities. And then from Neri Birdsell, who is the exceptional education teacher at the Baba Kaveri Unified School District in Topawa, Arizona. So here's the question. How can states and localities intentionally partner with programs serving Native Americans, again, using blending, braiding, and perhaps sequencing? So let's go to Kristen first.
Thanks, Vince. Just wanted to, can you hear you? Can you hear me? Hello?
Yes, thank you.
Okay, all right. Thanks for that introduction. Really started talking off with a partnership with the Sonoran USAID. You've heard others talk about the partnerships are so important. And so as we were talking about how do we serve these rural areas and underserved populations, how can we leverage funds from one source, leverage capacity, knowledge and skills from another, leverage staff resources from both entities or even all three. What can be done there? We have an existing agreement and we have an interagency governmental agreement with USAID, and USAID came to us and we talked together, and certainly it's a priority for the VR program to serve our Native populations. And Wendy had some established connections. So we just talked about, well, what could we do? How could we make this work? So I'll pass it over to Wendy to talk about a little bit about how that went in the actual service provision.
Yeah, thanks, Kristen. And it's really helpful to have the formality of funding, but we've also found that these strategies can be effective whether you have funding or not. And I think that's really an important point, that we don't just have to wait until we receive the funding. And that's exactly what we did. We started those connections prior to the partnership with vocational rehabilitation. So I think it's important to initiate, reach out, take the time to build that relationship. and maintain that communication. Be consistent, find out the best ways to communicate. Some don't like email, some like personal visits, some like phone calls, and you've got to make it meaningful and those opportunities to get together. And then this, I think, is one of the hardest things. Don't have an agenda. Spend time, listen to each other, and share and get to know each other. That really is helpful because you can start listening, hearing what those needs are, hearing where you can intersect, and hearing where your resources can come together. All of the systems and the terminologies are not always the same. They may not make sense. So if you listen and hear those opportunities, find the ways, and then offer, offer here, this is an opportunity, here's some resources, here's how we can come together. And I think another important aspect is to make sure you're connecting and bridging everyone. We brought in tribal vocational rehabilitation and other providers in the schools and entities and all the stakeholders. And when you bring the resources together, when you braid the funding, it always enhances what's available, and it allows you to bring your contributions, your expertise, and all come together to improve and remember addressing those needs that we heard earlier on. So I'm going to hand it over to Neri now, who can describe exactly how we did that and all the things she's done down at Baba Kibri.
Good afternoon, everybody. It's very nice to be here again. Thank you, Wendy. Yes, we have really great partnership with our local agency and in Arizona, it's local actually and state agencies. Our school district is located in the Native American reservation, Tohono O'odham Reservation. And if most of you are, if you are working in a rural area, you will realize the many challenges that we have. But the first thing that we did when we started out our program is to identify our strengths and our needs. On that, we identified that interagency collaboration is our need. So we continue to reach out. So there are three things that I want to share today. We could, like what Wendy was saying, you continue communicating, you sustain it, you maintain it. You don't feel discouraged when one partnership doesn't work. You just keep going, you keep searching. Another thing is we focus on service. We are educational institution. We're able to provide services for our kids. We can train them, we can instruct them, but we know our needs. We need support with workforce and career development. That's when some of the agencies that you reach out to, they can help you. So that's what we're going on right now. And we also continue improving our program and monitoring what we are already working. Every year, I always try to think of one initiative that I want to add to the many plans that we already are monitoring. So we have so many successes, and I'm so fortunate being in a rural area working for Native American population. We have students who are who already participated in summer work program through the funding from the state office and also from local agency. We have students who graduated, they're under the work adjustment program under VR. We're trying to connect with One Stop through the tribal One Stop, and also we're trying to develop some of our students who graduated, develop them and train them to be part of our workforce within our school district. So those are great and wonderful progress that we have made with our collaboration. So my interagency collaboration, we're going to the, going up on our progress right there. So hopefully all of you will be able to also provide those services for your kids and make strong collaboration with different agencies.
And as if on cue, to prove that Mary's in the school bell rang, right? So we all know what that sounds like. Thank you all from Arizona. That's great to hear how that really worked out in practice, and how money is not really, doesn't have to be the driver, often isn't the driver. It's really about other things first. So thank you so much for that. Moving along, I think it's time for us to go to Colorado, perhaps, with the next question. Let me see here. I think we have a question for Darby Remley, who's the coordinator at the Colorado Division of Vocational Rehabilitation, and is with Katie Talercio, who is the Employment Contract Specialist at the Colorado Department of Healthcare Policy and Financing. And the question is whether you've run into challenges that the other states, or any of the states that might have faced, whether you faced them in your state as well, regarding kind of the difficulty in maintaining direct support professionals in the field. If not, do you have specific strategies that you recommend to other states about how DSPs could be supported and be maintained over time?
Perfect, thank you. And this is a great question because I feel as though kind of that workforce and turnover within DSPs in any state, I hear a lot of feedback from other states. This is really kind of a nationwide issue, and that shortage of DSPs is really something that we all struggle with. So when I saw this question and that whole if not part, I really wondered, does anyone not have this run into this problem? And so in the state of Colorado, we are lucky to have quite a few providers to be able to provide any kind of direct support services to the individuals that we serve. So we can braid our funding in net and braid those services in net providers who are program approved service agencies, or PASAs as we call them. Those are those providers that can bill to Medicaid. Many of those same providers are also the vocational rehabilitation approved providers. And so what we do a lot of times is really work with our providers to, whether they may just be a PASA, a program approved service agency, to then also turn around and get them connected with DVR and get them registered as a vendor through us. That's a way that they can really ensure that they can have access to providing services to individuals that are connected with DVR or whether they're being served through a Medicaid waiver. Another thing that we've really done to try and encourage providers to stay in this field or to kind of enter into it is some of the fees that we have listed through our fee schedule. Especially with DVR, we have some of these incentive payments that we can offer for things like placing individuals very quickly, placing individuals into jobs at a higher pay rate. So some of these incentive payments have really encouraged providers to really want to work towards placing people in good, high-paying jobs. And then also some of those milestone payments, so payments for placement, for stability, and for successful closure. These are things that some of the Medicaid waivers don't provide. So again, another encouraging reason for them to be a DVR-approved vendor. And then also just increasing some of the rates that we have for some of the services that they provide. As of July 1, we just recently updated our fee schedule to increase customized employment services, those rates by 18%. So we increased those rates to really encourage providers because in the state of Colorado, we do require that they have that performance-based certification to be able to provide customized employment services, which is a little bit more work for those providers. And so we really wanted to encourage them to go through that because when they're providing those services, they are getting paid a higher fee for that. And then also just really working towards encouraging those providers to get that training and to get those certificates or certifications to really increase the level of service provision, especially when they're working with our supported employment individuals. In the state of Colorado, we do have Senate bill funds that we can reimburse providers for going through and getting additional training, because we require our supported employment providers to attend an ACRE approved training program. We can reimburse these providers up to $1,200 for obtaining the certificate. Many of those training programs only cost $400 to $600. So that's additional money that they're kind of walking away with for that time spent to attend those trainings. So, so different ways to just really incentivize these providers to want to stay in the field, and that they can have access to these higher rates and these higher fees, and really kind of encourage them to stay, because they can earn more money in this field. So, and I think I was just covering this. I think Katie was going to talk a little bit later, but I was just really going to be covering this question.
Great. Yeah, I really appreciate the thoroughness with which you addressed it too, because it really is a helpful set of ideas and strategies that will help support direct service support professionals. I think it's time to go back to Maryland with the next question. This time we'll hear from Lisa Dunaway, who's the manager at the Anne Arundel Workforce Development Corporation. Lisa, do you have best practices to share about working with the apprenticeship system for either braided or blended, blending your resources?
Yes, Vince, thank you. Excuse me. So when we work with individuals that are going into the apprenticeship system, I think our best practice that we've identified is to create a resource team around that individual. And when I mean that, I mean bringing the different partners, the different agencies or service providers that might be working with this individual, such as VR, it could be Department of Social Services, it could be our local Title I provider, whoever those service providers are, bringing them to a table, forming a team, and addressing the individual's needs as they're identified. This allows for a more holistic, robust, service service delivery offered to these individuals, so that all of their needs are met, so that they're more successful. The needs being, it could be, that apprenticeships are such a long period of time, usually 2 to 4 years length of time, and there's different costs associated for them to be successful. So one agency might be able to supply the resources for the supportive services, any kind of equipment they might need for working, anything that it's going to be able to allow them to work. We might be partnering because there is funding necessary for the occupational training. So we might be working together to provide that resource as well. And then as we're working together and identifying these needs, we're also able to identify that provider who's going to be best suited to provide that resource or service, so that we know that the individual is 100% supported and going to be successful. So.
Great, thank you. I think on our trip through the country here, we're going to go back to Colorado with the next question. And it has to do, let me just read it right to you. In working with students, is there a particular entity, perhaps the educator, that assumes a leadership role in bringing multiple organizations together to support the student? Or is the leadership assumed on a kind of situational basis? Lisa, is that for you?
Nope, this is me with
Darby.
Darby.
Okay, you go right ahead, Darby.
Yeah. So Darby with Colorado. So this was a interesting question, because my background is in special education, and then now I work for the Division of Voc Rehab. So it was fun to kind of tackle this question, because I get to wear multiple hats with this. But really, when we think about this question and identifying who that person is or what agency that is that's really getting that student or that youth with a disability connected, we're really looking at kind of the process of getting them connected. So ultimately, it does start at the school level. So whether they have a special ed case manager or a transition coordinator that they're working with, it's really they're kind of the one that starts that process and getting them connected based on what's written into their IEP. And so as we know, IEPs become transition IEPs at the age of 15. And so that's really when those questions need to start being asked and talking about what kind of resources will be needed in order to support this student after they exit out of school. And so here at DVR, we have developed a framework to support families and educators and service providers who work with students with youth and disabilities. We understand that sometimes these special education case managers or transition coordinators may not know all the services or know all the service providers that are out there that could support these students after they exit out of school. And so really that's what this framework is for. So it is a sequencing of services that was developed to increase that collaboration amongst the schools and the various entities that support these students or youth with disabilities really as they move towards their post-secondary visions and really what their life is going to look like after school. So this framework is designed to assist those local interagency transition teams to identify what programming is out there and what services can these students, no matter what the ages they are and kind of no matter what their level of disability is, really what those services are that are available to these students and youth. And then just also it really lays out a framework of what the roles and responsibilities of the agencies are in providing these services. So this framework really helps to guide the students team or this youth with a disabilities team really from the age. I mean, these conversations can even start prior to them being of that working age to start talking about these kind of things. But it can really start those conversations, help to guide who is ever starting those conversations, whoever is writing that IEP, to really have that framework and have that path to lead that student and their family or their support system in the right direction with getting connected to the right kind of agencies and service providers to best support this student.
Great, thank you so much, Darby. We had a question come in about the MOU that you might have heard about with the Maryland, with the last webinar where Mike DiGiacomo, who's the executive director at the Maryland Workforce Development Board, told us about the MOU they've created. And so, Mike, to you, can you talk about why this MOU mattered so much about among your partners, and what have been the benefits for them, and what has been the impact of having the MOU?
Yeah, Vince, thank you so much. I'm going to build on a little bit about what our awesome panelists have already talked about. But that we started 7 years ago with a vision, and the vision was to create a holistic approach to serving both the employer and the job seeker, right? And in order to do that, we created an interagency group of individuals, inclusive of our local workforce boards, community partners, and employers, to be able to get together and have those conversations. One of the interesting things is that we talk about consistency. This group is about 25 people. We've been getting together for 7 years on a monthly basis for 2 hours. So when we start talking about relationships and communications, that consistency and having those communications around not only the MOUs, but we use that group to talk about connecting folks with disabilities to employers, how to get folks with disabilities into a career pathway to a community college. We use this group to talk about our state and local plans. So we talk about the benefits of the MOU process. You know, the process are, once you get people together in a room with the same vision and some consistency, you get to build those relationships. So at the local levels, when things start to, go sideways, when partners say, I don't have money, or I'm not gonna, I can't do this, there's always a group to go back to help to mediate that conversation. So, I would just say that it's really about, communication and the commitment, but I think it's also about consistency. Many of us talk about building relationships and communications, but when you have the same group of people to get together for 7 years, you really start to build relationships and learn a whole lot about each other. And so that when issues do arise at the local levels, you're able to have open, honest conversations about how to get them resolved.
Great, thanks. It sounds like it's also a fair bit about diplomacy. So, and the closer you are to your partners, of course, the easier that becomes. So that's great. Thank you so much. We're going to go back to Arizona with our next question. This time to Kristen. Can you share your experience in how to braid workforce funds that are not specifically for people with disabilities, such as, say, WIOA Title I dollars, and how you can braid them with disability-focused program funding sources? That was a question that came up at one of our last webinars.
Sure. We're talking about, in Arizona, we have conversations with our local workforce areas. What is needed in a local area in order to serve an individual that comes into the local workforce area for services? They don't always need to get a pivot back to VR. So what is something that's needed in your local area, in your local one-stop in order to serve individuals? So we've done a couple different approaches. We can be the subject matter expert and provide training. We can arrange for how do we upskill the staff for the local area. We've also taken the approach of, we will provide some of the assistive technology that would be needed in the one-stop so that individuals can use those services at the one-stop. Also we're the subject matter expert. The one-stop reached out to me and said, hey, we're revamping our one-stop location, and we'd like to make sure we have everything we need in order to serve individuals with disabilities. What should we have? And so then we, take our teams in and provide that information on what types of equipment, what types of software should be available in their space in order to effectively serve individuals with disabilities. So again, we think the common thread around all of this is just having that open communication and sharing obviously what our expertise is and what we can do, and then being open to determining where is the cost benefit, how can funds be used, what's the allowability of those funds also, and so being very creative and flexible within the guidelines on how to use the funds from the different partner perspective.
Great, thank you. It's good to hear how some of these other dollars can really be integrated and blended or braided, at least in this case. So let's get to the next question. We had a question come in. What are some examples of states and localities using interagency agreements to design collaborative resource leveraging processes? And I think we're going to go to Maryland. Kate and Stacy. What's your experience? Do you have experience in that arena?
Sure, thanks. In Maryland, we have a formal memorandum of understanding between the Maryland Division of Rehabilitation Services and the Behavioral Health Administration. The agreement is really a result of years of collaboration, learning how we do it. The agreement clearly stipulates how we do business together, our policies, our procedures, how the funding works, what to do if there's problems that need to be resolved. It really is a very comprehensive document that goes through each and every type of scenario in which we would have working together. You know, the agreement is crafted right now. We're crafting our updated agreement, and it's taken a while. I think the pandemic had something to do with that. But like I said, we are extremely collaborative, and it's not just a matter of we wrote it, we send it to them, they sign it, we get it done. We write it together. And that way we have a chance to insert updates to regulatory requirements as they occur, and updated practices as things change a little bit from year to year. So that's really the nuts and bolts of our memorandum of understanding.
So these discussions that are around this higher level agreement between the Division of Rehabilitation Services and the Behavioral Health Administration are an ongoing process between agencies. For example, over the last few years, we focused heavily on working through implementation of Maryland's newer, not new anymore, administrative services organization platform, like the new vendor, implementing all of that. That platform's where the providers request authorization for public behavioral health services, but it also serves as a single point of entry into support employment, which includes that referral to the Division of Rehabilitation Services. So these details are things that are all outlined in that memorandum of understanding. And then we also have a few smaller agreements, such as a partnership plus agreement between the Division of Rehabilitation Services and our administrative employment network to ensure that seamless transition and connection to employment networks for access to that Ticket to Work program and services. And there's also an agreement between our Behavioral Health Administration and our local behavioral health authorities in each jurisdiction for that ongoing monitoring of behavioral health provision on a local level. So to circle back a little bit on that earlier conversation about making that braiding, blending, and or sequencing of funds seamless to the individual, you know, these interagency agreements really are essential in ensuring that the individual can truly focus on the rehabilitation and recovery rather than who's going to pay for the services they're receiving.
Great, thank you. All right, we have time for maybe 2 more questions, we hope. Let's go back to Colorado with the next one. Do you blend and braid with the Medicaid buy-in program in your state, in Colorado in this case? Is it helpful or was it difficult to access, Katie?
Yeah, thank you so much. It's so fun to be a part of this panel. I'll try to focus on my answer because I'm thinking about all these other great examples. But yeah, absolutely. I love this question. And I almost want to start by saying the Medicaid buy-in can actually be almost the launching pad to a lot more braiding and sequencing, which is super exciting. And just to give a quick example, is we're working to eliminate sub-minimum wage here in Colorado, sub-minimum wage employment. And some people in that process have been looking for part-time and full-time work. And one of the biggest questions that comes up is, what does that look like if I'm utilizing services for job development in DVR, maybe job placement, but maybe I'm also getting some services through the waiver, which could be group supported employment, which is segregated, but I do have a job goal, I want to get a job. And what does that look like for the supports I need and my benefits? And we get to say, absolutely, let's make sure that we explore that together, make sure you know how earning income can impact the different public support that you get, but how you can also start earning more and more income and keep that support that you need through Medicaid. So I feel like we could talk about this forever, but I love this question. And yes, absolutely. We hope that this is a door opening for people to get good jobs with good pay.
Exactly. And speaking of door opening, our next question, which is one that just came in from this webinar, is about co-enrollment as a way, and the question is really whether you use data on co-enrollment to measure progress or evaluate the outcome for individuals co-enrolled versus those enrolled in a single program. Again, co-enrollment as one way of doing blending or braiding, really. In most cases, that's a braided approach. So Alice in North Carolina, I think that's something you do, or at least you know about.
We do know a little bit about it. We are right on the cusp of developing the tool that we are going to use to measure co-enrollment and measure progress and success. And we're very anxious to get this rolling. We are just so close to getting there, but we really want to evaluate how our funding structure is working. We want to see how it might be driving quality services or kind of backfiring. We want to be able to use the data to find out where people are dropping out of the service. And I'm speaking specifically for individual placement and support services, find out where people are dropping out. And then we want to tailor some training around those areas to see if we can't make some positive impact to help people get closer to reaching competitive integrated employment.
Great, thank you. And I want to thank all of our expert panelists. It's 11 individuals with their respective expertise from 4 different states. So this is really spanning the country and spanning the agencies that and really giving us a flavor. Really appreciate the questions that have come in both in previous webinars and on this event. We would like to have you tell us what you thought of today's sessions. What are you taking away from today? We have another little poll for you, and one action you plan to take based on what you learned today. So the poll here will pop up momentarily, and we'd love for you to give us a sense of what you're taking away from this. Oh, sorry. This is actually, in this case, you were answering this in the chat. We're calling it a poll, but it's actually something you can do right in the chat. So use the chat window to tell us what you learned, one thing you learned today, and one action you plan to take based on what you learned today. And I will go on in the interest of time, want to tell you a couple more things about resources that are available. First of all, this is the mention that we had at the beginning of the session, that this joint communication to state and local governments is forthcoming, and it will be posted with the resources from this webinar sometime next week. So keep an eye out for that. And one very good way to keep an eye out for resources on this topic is to go to the Lead Center website, sign up for information and notifications there. And that way you will actually get notified whenever we have communications on this topic and other useful topics. I want to give a huge shout out and thank you to all of our panelists and the questions that came in and those terrific answers that came in. This webinar, of course, was recorded. And so, as I mentioned, we will post this event's recording, the transcript at the end of next week. There's a very robust library of resources on our site. There's some data visualization tools, a searchable database of state-specific policies and data, and it's all free and freely available and easily to access. So we also encourage you to sign up for the newsletter, and we encourage you to stay connected with us. Follow the Lead Center on both Facebook, Twitter, LinkedIn, and on YouTube. So I want to thank all of you for joining us today, and thank the team in the background that were making sure that these questions were sequenced and properly put into the feed. And again, thanks to the panelists, the expert panelists from throughout the state, and wish you a good rest of the day.